20% of the global population experiences at least one episode of depression before they turn 18. The risk of suicide rises to up to 20 times in depressed people as compared to non-depressed individuals. Women are twice as likely as men to develop depression, and almost 50% of people who develop depression do not get the help they need. Hello everyone, I'm Dr. Anuneet Sabharwal. I'm a Delhi-based psychiatrist with a decade-long experience in mental health, sexual health and addiction. Because this topic is so huge, I'm going to divide it into 3 videos. So the first video, which is today, I'm basically going to define depression and answer some frequently asked questions. In video number 2, which will be the next one, I'm going to talk about the risk factors and causes of depression. And in the video number 3, which is the last video, I'm going to talk about the treatment of depression. Okay, let's go. Because depression is often a loosely used term, I'm now going to define the signs and symptoms of clinical depression. Now, the symptoms of depression can vary from being mild to severe and often include persistent sad, anxious or empty mood, feelings of hopelessness or pessimism, feelings of guilt, worthlessness or helplessness, difficulty in thinking, taking decisions or concentrating on work, loss of interest or pleasure in previously pleasurable activities, also called anhedonia, restlessness or irritability, changes in appetite leading to either weight gain or weight loss unrelated to dieting, sleeping too much or sleeping too little, loss of energy or increased fatigue, pains, aches, headaches, cramps or digestive problems that do not have a clear physical cause and that do not respond to treatment, and lastly, thoughts of suicide or suicide attempts. So for a diagnosis of clinical depression, most or all of these symptoms must be present for a minimum of 2 weeks. To assess the severity of depression, mental health professionals often use questionnaires or rating scales. The 2 most commonly used and most popular ones are Hamilton Rating Scale for Depression and Beck's Depression Inventory. Contrary to what most people believe, the symptoms of depression vary widely with age and gender. Depressed men, for example, are much less likely to experience feelings of self-loathing or hopelessness. Instead, they complain more about fatigue, irritability, sleeping problems, and also anhedonia. In addition, they are much more likely to experience symptoms such as anger, aggression, reckless behavior, and substance use. Women are more likely to experience pronounced feelings of guilt, excessive sleeping, overeating, and weight gain. In addition to this, depressive symptoms in women are also impacted by menstruation, pregnancy, and lactation. In fact, up to 1 in 7 women experience postpartum depression. The one additional thing to note here is, although the levels of depression and the frequency of depression is higher in women, men are more likely to complete a suicide attempt than women. In teenagers, anger, agitation and irritability are often the most noticeable symptoms of depression, not sadness. In addition, they may also complain of headaches, stomach aches, or other physical pains in order to avoid going to school. For older adults, depression mostly presents with physical and cognitive signs rather than emotional ones. So these will include unexplained pains and aches and memory problems. They may also start to ignore their physical appearance and may start to deliberately stop taking medications which are critical for their health. Now, the reason why the word depression is used loosely is because it is often confused with natural mood states. The death of a loved one, loss of a job, or ending of a relationship are all extremely stressful situations for a person to endure. And so, a person going through any of these situations is naturally going to expect some amount of sadness or grief. But having sadness and having depression are completely different things. Depression and grief or sadness are different in important ways. In grief, painful feelings come in waves and are often intermixed with positive memories of the deceased. In depression, mood and interest in activities are decreased most of the time. In grief, self-esteem is often maintained, but in depression, feelings of hopelessness, worthlessness, and self-loathing drastically reduce self-esteem. And lastly, even though in grief the person may have death wishes, the death wishes are a consequence of a fantasy involving joining the deceased person. Whereas in depression, death wishes are a consequence of decreased self-esteem and being unable to tolerate the pain that comes with depression. Having said that, grief and depression can coexist. In some people, a grief reaction is also accompanied by a much more severe depressive reaction to an extraordinary stress. Now, grief with depression is often more severe and lasts much longer than grief otherwise would without depression. Okay, so let's talk about the types of depression. The first one is major depression. Now, I've already talked about the signs and symptoms of major depression, so I'm not going to go into the details. But an episode of major depression usually lasts between 6 to 9 months if it is not treated, and a person may experience multiple episodes of major depression during the course of their lifetime. The second one is dysthymia. Dysthymia is a kind of recurrent, mild to moderate, low-grade chronic depression. In dysthymia, a person often begins to feel that they've always been depressed or that they've always been like this. A person who has dysthymia, however, may also have, on top of dysthymia, episodes of major depression. Now, these episodes of major depression, when they occur on top of dysthymia, are referred to as double depression. The third one is perinatal depression. Now, women with perinatal depression experience full-blown symptoms of major depression either during pregnancy or after delivery, when it is called postpartum depression. Number 4 is seasonal affective disorder. SAD is a kind of depression that comes and goes with the seasons, typically starting in the late fall and early winter and going away during the spring and summer. Number 5 is psychotic depression. Now, this is a form of severe depression which is accompanied by some form of psychosis, which could either include a fixed, false, firm belief that is also referred to as a delusion, or hearing or seeing upsetting things that other people simply cannot hear or see, which are referred to as hallucinations. Number 6 is atypical depression. Now, in this kind of depression, there are atypical symptoms that dominate the syndrome. Now, these symptoms will include oversleeping, overeating, a phenomenon called laden paralysis, where even simple things like walking become too difficult for the person, and interpersonal rejection sensitivity, which means that the person starts to look for reasons why other people are rejecting them even when they're not. Depression is a recurrent disorder, and about 50% of people who have a depressive episode go on to have another one. Studies show that the likelihood of a recurrence of a depressive episode is dependent on the number of life stressors a person has. Studies also show that the longer these episodes last, the lesser the likelihood of recovery. There is some evidence to show that depression itself changes the brain, diminishing the ability of the brain cells to form new connections among themselves and also consuming the existing reserves, and this curtails the capacity of the brain to recover. Although depressive episodes do go away on their own in the initial part of a depressive illness, it's not worth the wait, and the reason for that is two. The first one is, of course, morbidity or quality of life, which is greatly hampered, and the risk of suicide that increases if the depression is untreated. And number 2 is that experts now believe that inflammation that is caused by depression causes degeneration of the brain, and that in a vicious cycle accelerates the pathological changes in the brain that make future recovery from depression even more elusive. In psychiatry, we do not use the word cure. Instead, we use the word manage. Unfortunately, depression is not an illness that has a complete cure. Also, even with effective treatment, sometimes a relapse may occur. This is referred to as a breakthrough episode. However, there is a plethora of treatments available for the management of depression today. Contact your psychiatrist today and follow their advice to the T. Okay, so this brings me to the end of part 1 of depression. In part 2, I will be discussing the causes and risk factors for depression. Stay tuned.